The role of alternating bilateral stimulation in establishing positive cognition in EMDR therapy, a multi-channel near-infrared spectroscopy study. This is published online October 12, 2016. Zoe Kapula was the editor, and it's published in the National Library of Medicine, National Institute of Health. Abstract. Eye movement desensitization and reprocessing, EMDR, is a standard method for treating post-traumatic stress disorder. EMDR treatment consists of desensitization and resource development and installation, RDI, stages. Both protocols provide a positive alternating bilateral stimulation, BLS. The effect of desensitization with BLS has been elucidated. However, a role for BLS in RDI remains unknown. Therefore, it's important to measure feelings as subjective data and physiological indicators as objective data to clarify the role of BLS in RDI. RDI was administered to 15 healthy volunteer subjects who experienced pleasant memories. Their oxygenated hemoglobin concentration, a sensitive index of brain activity, was measured from the prefrontal cortex to the temporal cortex using multi-channel near-infrared spectroscopy during recall of a pleasant memory with or without bilateral stimulation. The BLS used was alternating bilateral tactile stimulation with a vibration machine. The psychological evaluation suggested that RDI was successful. The results showed that compared with non-BLS conditions, accessibility was increased, and subjects were more relaxed under the bilateral stimulation conditions. A significant increase in oxygen was detected in the right superior temporal sulcus, and a decrease in the wide bilateral areas of the PFC was observed in response to BLS. The significant BLS-induced activation observed in the right STS, which is closely related to memory representation, suggests that BLS may help the recall of more representative pleasant memories. Furthermore, the significant reduction in the PFC, which is related to emotion regulation, suggests that BLS induces relaxation and comfortable feelings. These results indicate an important neural mechanism of RDI, that emotional processing occurred rather than the higher cognitive processing during this stage. Considering the neuroscientific evidence to date, BLS in RDI may enhance comfortable feelings about pleasant memories, and based on the current findings, the use of BLS in RDI may be warranted in some clinical situations. Introduction. It's common for people to experience severe stress immediately after a traumatic incident, but most people can resume their life within a few months. Most people are resilient and eventually recover from tragedy over time. However, some experience prolonged stress, known as post-traumatic stress disorder, PTSD. PTSD is defined as a particular set of reactions that develop in people who have been through a traumatic event that threatened their life or safety and led to feelings of intense fear and horror. The main type of PTSD symptoms are re-experiencing the traumatic event, avoiding reminders of the trauma, and increased anxiety, emotional arousal, and negative cognitions, which occur automatically. There are some effective therapeutic methods, one of which includes the process of desensitizing traumatic memories and establishing positive cognition. In the later process, a client is usually asked to think about personally meaningful, positive experiences that are associated with well-being. These personal positives may take the form of positive personal experiences of self-soothing, self-efficacy, self-acceptance, or courage. Thus, there are two cardinal components of the PTSD therapeutic process. One is to remove the traumatic memories, and the other is to establish positive cognition. Eye movement desensitization and reprocessing, EMDR, is a standard method for treating PTSD and has been recommended by the American Psychiatric Association. This technique involves a unique procedure in which the therapist exposes the patient to bilateral stimulation, BLS, which involves alternating bilateral visual eye movements, auditory or sensory stimulation, example tactile stimulation. The standard EMDR protocol consists of two main stages: desensitization of traumatic memories and develop an installation of a resource, such as safe and pleasant thoughts. The later is called resource development and installation, RDI. In the standard protocol, both stages use alternating BLS. BLS is performed concurrently with the recall of the worst image of the trauma and the resources installation. RDI has become a powerful psychotherapeutic tool for relaxation and encompasses a wide range of resource development interventions during the stabilization phase of PTSD treatment. The EMDR protocol includes 8 phases. Phase 1 involves gathering data about the patient's history and clinical symptoms. Phase 2 establishes a therapeutic framework and defines the appropriate level of expectations. Phase 3 focuses on assessing trauma-related symptoms that involve vivid visual imagery associated with traumatic memories, positive and negative belief about self, relevant emotions, and bodily sensations. Phase 4 is the primary therapeutic stage, in which alternate BLS is used to ameliorate traumatic reactions. Phase 5 involves cognitive modification, in which positive cognition is installed. Phase 6 involves a scan of bodily sensations to identify pain or abnormal experiences. Phase 7 is the closure phase, and Phase 8 is used to prepare for the next session. RDI is typically used during the preparatory phases, Phase 2 and 3, but RDI can be attempted whenever the therapist feels it is appropriate. Although the effects of BLS on desensitization has been elucidated, the role of BLS and RDI remains unknown. Hornsfeld reported that BLS decreases vividness, pleasantness, and experiences of strength of the intended quality or resource. They suggested not using BLS and RDI because BLS may disturb RDI. However, Leeds and Korn advocated the use of BLS as an important element in the standard RDI protocol. Thus, whether BLS is beneficial for RDI is controversial. Our previous clinical studies showed that patients with chronic pain and those with dementia were stabilized by BLS, alternating bilateral tactile stimulation on their hands or knees during RDI treatment. We reported that BLS was a vital tool in RDI, and in this study to clarify the role of BLS in RDI, 15 subjects either received or did not receive BLS, example alternating bilateral tactile stimulation with the machine while recalling their own pleasant memories. Conclusion. Clear differences between using and not using bilateral stimulation were observed based on the subjective interview and the NIRS biological data. Our results indicated that using bilateral stimulation increased the effectiveness of resource and development installation over not using the bilateral stimulation.